Hi, my name is Dr. Lask. I'm a consultant radiologist, and every once in a while you get a case that literally blows your mind, takes your breath away, maybe even makes you skip a beat. That's why I do radiology. It's awesome. So we're going to go through another case donated by Everlight Radiology. You can check out Everlearning website. Everlight is a teleradiology company that specializes in offshoring radiologists. Now, if we look at this particular scan, this is a CT scan of an adult patient who came in with shortness of breath and chest pain. This is a CT pulmonary angiogram, i.e. we put contrast to be within the pulmonary arteries because we're looking for something known as a blood clot, i.e. a pulmonary embolism. Now imagine if you are drinking some bubble tea and one of those little annoying bubbles get into the straw and you can't get any of that fluid out anymore. That's essentially what you're looking for when you're looking at a CTPA. You're looking for contrast and a bit of that bubble tea inside the vessels, and that would be a filling defect. Now when you look at this scan, this is easy, isn't it? There's a few filling defects here. These vessels should not look like that. They should not have anything within the blood vessels at all. This is a pulmonary embolus and we can go home. That's great. Now, hang on, there's actually a bit more to this. If I go to the next image here, you can see that there is contrast located in the right atrium and also in the left atrium. Now, ordinarily you may think, who cares? But this is an issue because what happens is that when you inject contrast into the human body, you're generally injecting into one side of the circulation. It's either going to be the arterial system, it's going to be the venous system. Now, when you're doing a CT pulmonary angiogram, you'd be expecting the contrast to be within the right ventricle. But in this situation, you've also got on the other side, there's been contrast has gone on one side and crossed the border and gone to the other side. Now, the other way that can happen is something known as a patent foramen valley. Now, usually that's not too big of a deal. Most people can survive with it. But this one is different in the situation. Now, there is also a filling defect located in the aorta. So what's actually happened is that the blood clot has gone from one side of the heart through this little defect, this magic door, to the other side, then gone into the aorta. But on top of that, it's also gone down a right coronary artery, which basically means that this patient may end up having a heart attack. So this is one of those findings that are fairly common, which is presented in a fairly common way, but then end up having a few unusual things that have happened because of the innate anatomy of the patient that's ended up having it. Anyway, I hope you found that interesting, and I'll see you on the next video. Bye.